My name is Alvarez, and my topic is Tenofovir versus placebo to prevent perinatal transmission of hepatitis B. Definition: Tenofovir is an antiviral drug used for the treatment of the infection by immunodeficiency virus, agent that produce AADs, and for chronic infections with hepatitis B. Placebo: a harmless pill, medicine, or procedure prescribed more for the psychological benefits to the patient than for any physiological effect. Now we have a video to explain the hepatitis B.
Hepatitis B is an infectious disease. It is a virus which is called hepatitis B virus, which infects the liver. Usually in young and healthy people, the virus is cleared in about 90% of the individuals. However, in newborns or in older patients or immunosuppressed patients, the virus can persist.
Chronic hepatitis B infection happens when your body is unable to eliminate the virus, and it persists in your liver for long periods of time, sometimes for decades, and then ultimately can lead to cirrhosis and hepatocellular carcinoma. Globally, the number of people who are serologically positive for hepatitis B is over 2 billion. The number of chronic carriers, the estimates vary, but it's somewhere between 150 and 400 million carriers.
Now the medical applications. The use of placebo is evident in some diseases where pain plays an important role and in psychosomatic diseases. The degree of the placebo reaction depends, among other factors, on the characteristics of the patient. Therefore, they are divided as responders and non-responders to the placebo, and the attitude of the doctor who indicates.
Hepatitis B is an infectious disease. Particularly in its chronic form, it is associated with severe suffering and even death. The outcome of an infection with hepatitis B virus is determined by the individual immune response. If this is insufficient, chronic hepatitis B develops. After HBV has entered a liver cell, genomic HBV DNA is transported to the nucleus, where it is converted into covalently closed circular DNA. This cccDNA functions as the template for the transcription of several viral messenger RNAs. These are exported to the cytoplasm and then either translated into viral proteins or packed into nucleocapsids and converted back into viral DNA. A newly formed virus is released from the cell, as is the hepatitis B surface protein, detectable as HBs antigen in the serum. If the patient's immune response is inadequate, the virus can proliferate. Among other viral markers, serum levels of both HBV DNA and HBs antigen rise. The HBs antigen level is an important diagnostic parameter. Persistent HBsAg levels are associated with increased risk of HCC. Clearing HBs antigen and/or seroconversion is closest to a cure in the treatment of chronic hepatitis B.
Now the applications in Ecuador. Vaccinate a newborn in the first 24 hours is essential to prevent mother-to-child transmission of hepatitis B. In Ecuador, for example, hepatitis B is a notificable disease, and the most important preventive intervention is the universal vaccination, which can prevent infection in 95% of cases.
Viral hepatitis commonly with a hepatitis B and hepatitis C. In the United States, it's probably more common with a hepatitis C, and we have a lot of achievement in terms of the treatment for the hepatitis C. So a lot of exciting and very effective medications have come out. It's really different than hepatitis C because of the nature of the disease. So I feel like the hepatitis is quite interesting in terms of their management. Chronic hepatitis B depends on this virus is because of it's a DNA virus, so it's very difficult to use a medication to clear this virus. That's why it's very hard, not like hepatitis C. It's very hard to cure hepatitis B. Hepatitis B management is different based on the viral replication, based on different phase of the hepatitis B infection, and also depends on the patient's other the conditions such as co-infection with a hepatitis C and or with HIV. And the other thing for the hepatitis B is interesting is even if people have immunity or they have the hepatitis B infection, when they become sick, such as when they are have the chemotherapy for other cancer, so the hepatitis B can be reactivated and people can be very sick from that. We do have treatment for the hepatitis B, and the other thing is for the hepatitis B, people don't usually, if it's a chronic infection, people don't usually have much symptoms. So what we typically do is to keep a close eye on the liver, is because of hepatitis B can have increased risk for cancer even without progressing to cirrhosis. So this is one big part for compared to the hepatitis C. So this is routine follow-up and close monitor is very important for the hepatitis B management.
Now the pros and cons. The pros we have: Tenofovir lowers the chances of getting HIV complications such as new infections and cancer, and improves your quality of life. Tenofovir belongs to a class of drugs known as nucleotide reverse transcriptase inhibitors. And the cons we have that the improper use of tenofovir can cause dizziness, diarrhea, headache, and sleep disorders.
We have vaccination. We can start the vaccination for the baby who born from the mother who have hepatitis B. The higher the level of the hepatitis B the mother has, will increase the chance of the child having the virus during the perinatal, during birth, or in the first years of life from the mother. So at present time, we try to reduce the amount of the viral infection in the mother before birth, and after the childbirth, we usually will give the immunization to the child to prevent the infection from the mother. And it has been very successful in this prevention. And with the global use of hepatitis B vaccination, we definitely have less case of hepatitis B carrier and chronic hepatitis B infection. Now the child, if they got the vaccination and it is successful, and it can be successful more than 90%, and that will prevent the child from having the infection in the long term.
Now, in the conclusion, I have that studies suggest tenofovir prophylaxis had some benefits, although it was not shown to be superior to placebo in lowering the risk.
HIV is a virus that attacks the immune system. The virus causes a decrease in the ability to fight infections. The World Health Organization has set forth guidelines to help reduce new infections of HIV. The proactive action for prophylaxis for HIV is termed PrEP. PrEP stands for Pre-Exposure Prophylaxis. Currently, the World Health Organization suggests the use of a therapy that contains TDF. TDF, or Tenofovir, is a medication that inhibits HIV from replicating inside the cells. Recent animal studies have suggested that the PrEP therapy combo drug TDF with FTC may be more effective than TDF alone to defend from HIV. This study further explores these claims. The study enrolled heterosexual HIV serodiscordant couples in East Africa from July 2008 to November 2010. The HIV-infected partner was required to not qualify for HIV therapy under Ugandan guidelines. Participants were split into 3 randomized groups. One received TDF alone at 300 milligrams once daily. The second received the combo drug TDF with FTC, 300 by 200 milligrams once daily. The final group received placebo once daily. 4,747 couples were followed. 1,584 in the TDF group, 1,579 in the TDF with FTC group, with 1,584 in the placebo group. The exclusion criteria included hepatitis B, pregnancy, and breastfeeding. All participants received a comprehensive package of HIV prevention, which included education, counseling, testing, condoms, and offered immunization. Seronegative participants were observed at monthly visits, which included HIV testing, a 30-day supply of study medications, collection of the prior month's unused medications, and women were tested for pregnancy. The seropositive participants were observed quarterly. Those who became eligible for ART were referred to local clinics for therapy. 8 participants were found to be HIV positive before randomization. Of these 8 participants, 2 had resistance to study drugs, 1 for the TDF and 1 for the TDF with FTC. No participants who contracted HIV during the study had resistance to the study drugs. No significant difference in adverse events were observed in the study groups. Neutropenia was slightly higher in the TDF and the TDF-FTC groups than in the placebo group, as were GI side effects during the first month of therapy. The primary endpoint was a seropositive test in the partner previously seronegative. In total, 82 participants contracted HIV. 52 were in the placebo group, 17 in the TDF group, and 13 in the TDF-FTC group. The TDF with FTC group had a 75% reduction in HIV contraction versus placebo, while the TDF alone group had a 67% reduction. The study was ended early in July 2011, and the results were made public due to the efficiency of the TDF versus placebo for PrEP.